Good afternoon, everyone. My name's Lisa Bainbridge. Welcome to this live online session looking at how dental professionals use our scope of practice guidance. Our speakers in order today are Guy Rubin, Research Manager at the GDC, Jane Thompson from IFF Research, one of the lead researchers from the work, Katherine McGirr, one of our policy managers at the GDC, and your producers are myself and Helen Greevy from the IFF, who will also be moderating our Q&A for us. This session is being recorded and will be made available on the GDC YouTube channel shortly after the session. As I say, the Q&A facility is operating and is now open. We'll also be pausing at the end of Helen's session for questions particular to the research, and then again at the end for questions overall about the presentations. Please submit your questions at any time during the event. As I say, they are being moderated and we'll respond to questions that we can do during the session. So now I'm just going to hand over to Guy, who's going to start off the session for us. Thanks, Guy.
Good afternoon and welcome to this session. I'm going to start off by just explaining a little bit about how we got to this point, a little bit about the history of scope of practice. So in 2019, the GDC issued guidance on scope of practice for members of the dental team to support dental professionals through introduction of compulsory registration for previously unregistered groups, and the guidance supplemented the existing requirement to work within one's training, competence and indemnity. And the purpose of this guidance was to help dental professionals, employers, indemnifiers, patients and the public to distinguish between different members of the dental team, to prevent dental professionals from working out of scope and to help them work to their full scope by identifying core skills and additional skills. So then in 2013, we revised the guidance, and just to explain a bit of background to this. In 2011, we gave evidence to the House of Commons Select Committee on Health, and in that we gave a commitment that the GDC would keep the guidance under review to ensure that it did not unnecessarily restrict practice or stifle innovation in working methods with the dental team. And the evidence also introduced the issue of giving patients direct access to dental care professionals without having to consult a dentist first, and noted this was being given further consideration. So as a result of that, in 2013, direct access was introduced, and we revised the guidance for that reason, to take account of that. We also revised it because we wanted to make sure that we provided clear guidance to patients about what different registrants could and could not do within the context of direct access, and also to reflect advances in dental technology and in their education and training. So that gives you a little bit of background to where we were when we started this review. So in 2019, last year, in view of the commitment we gave to Parliament to keep the scope of practice under review, and in the light of technological developments, changes in training and education in the way that the dental teams and individuals operated, we agreed to carry out an assessment of the current validity and relevance of the scope of practice guidance. It's also relevant to point out that in recent years we've adopted a different approach to dental regulation, focusing on moving upstream with an increased focus on prevention rather than enforcement, and we wanted to ensure that the guidance was aligned with that. And finally, it linked to a wider piece of work we're doing on developing principles of professionalism for dental professionals. And for those who are interested, we recently published an evidence review and findings on professionalism, which are going to feed into the review. So just to say a little bit about how we approach this piece of work, there are two stages of the work, and we'll be covering both in this webinar. Stage one involved building an evidence base about how the guidance is used by registrants, the GDC and stakeholders, and identifying intended and unintended impacts and outcomes of the guidance, and gathering views on the future of the guidance. And I'll say a little bit more about that in a minute. So what we did was adopt an independent research approach of the scope of practice, and particularly we wanted to understand how scope of practice's purpose operated and we wanted to hear from the public, from patients, from dental professionals, of course, from other regulators with relevant experience of scope of practice, and from dental stakeholders and users such as the NHS, Health Education England and educators. And the aim was to provide sufficient evidence to inform and underpin future development, improvement and amendments to the scope of practice. And then this was to be followed by stage 2, where we would draw on this evidence and evidence drawn elsewhere to determine the future scope of practice at the GDC. So just finally, on the next slide. So as I said, we focused on this being an independent approach, and so we commissioned an independent research organisation, IFF Research, to conduct a review of the SOP guidance for the GDC. And in terms of what we covered, what the research covered and its aims and objectives, we wanted to understand what awareness there was of the scope of practice and how it was understood by the different dental professionals within the dental team. We also wanted to understand how it was used and what dental professionals thought of the SOP. As I said at the beginning, there are some specific objectives around why SOP was introduced in the first place, and we wanted to find out whether it was fulfilling those objectives, but also whether there were unintended objectives or things that hadn't been thought about that were occurring as a result of SOP. And finally, and importantly, we wanted to gauge views on the future of scope of practice. So should it continue to exist at all? Should it be in its current form, and who should be responsible for producing it? Those were some of the questions that we wanted the review to look at. So with that brief introduction and context, I'm going to hand you over to Jane Thompson from IFF Research, who's going to take you through the scope of practice review and its findings.
Thank you, Guy. So yeah, I will start off by just quickly reiterating the aims before moving on to telling you a little bit about what we did. So you can see there that kind of reflects what Guy just said. Just to say as well as monitoring to what extent the guidance document's working as intended and looking at unintended consequences, we were also focusing on really, is it fit for purpose today, is it needed, and is it valuable? To do this, we took a two-stage approach, started with a scoping stage and then went into the main stage of research. The aim of the scoping stage was really to understand the context of the guidance, so how it was being used, different issues around it, so that we could focus the main stage of the research most effectively. It consisted of a short focus literature review, some stakeholder interviews, that was both internal with GDC staff and various functions, and also some external interviews, which included a large indemnity provider, professional bodies, and a training provider. We also did some secondary data analysis of inquiries received by the GDC. That all fed into the development of a logic model, which mapped out current or possible outcomes and impacts of the scope of practice document. We fed that back in a stakeholder workshop to see what people thought of what we'd made as sort of initial inputs and to further kind of hone the next stage of the research. The second stage of the research expanded the number of stakeholders we were able to include and get opinions from. So that included 5 educators, an interview with a corporate, with an indemnifier, with an employer and a professional body, so just expanding that scope slightly. We also did a number of focus groups. So we did 6 focus groups and 2 depths with dental professionals, both dentists and DCPs, and also 2 focus groups with the public. That fieldwork took place in London, Birmingham and Edinburgh in October 2019, so almost a year ago. And we also added 2 questions to the dental professional survey as part of the research, just to get a bit of a larger base size on 2 key measures, which were awareness of scope of practice guidance document and also the use of that document. So in terms of the agenda, we'll just move through what the review was hoping to achieve. So talk about dental professionals' understanding of scope, use and awareness of the document. Then we'll dive in a little bit more to impacts of the document and people's perceptions of that. Then there's a separate bit about public perceptions of the document before we'll wrap up and draw some conclusions. So to start off with the understanding, awareness and use piece. It's clear that dental professionals are very clear on their own scope, but sometimes could lack confidence on the scope of others. So for most, education was the main source of their understanding of their own scope. and people felt that that initial training was thorough in outlining scope. Those who've seen more recent changes to their scope, so hygienists and dental therapists, for example, were more likely to be very aware of their own scope, with clinical dental technicians most likely to report a few grey areas in their scope, such as around digital impressions, being relatively new, not yet sort of specifically assigned to any particular professionals. It was a common view that it's everyone's role to know their own scope rather than the scope of others, with each person having a better awareness of their own roles and responsibilities. However, one important exception to this was DCPs believing that dentists should know the scope of all DCPs to ensure that they can refer and work with them appropriately. Carrying on that theme, some DCPs reported a lack of knowledge among dentists of their role. So dental therapists were one of those groups, saying dentists sometimes had a lack of knowledge about their role, their training, and also when they'd need permissions before undertaking a task. So as an example there, we've got in a quote about someone who was having root canals booked in for them to be done, which is not in their scope. Educators had similar views. They felt that dentists were rarely fully aware of the scope of DCPs, some saying that dentists could be surprised at the tasks dental nurses or therapists could potentially undertake. And dentists had mixed views on that, really. There were some that felt roles are well defined, or that there was no need for them to understand roles. So that could be, for example, if they rarely had a need to refer. So if you have many years experience working with colleagues, and you've built up sort of trust in and knowledge of that person's capabilities over time, you might not feel you have such a need to understand the scope of different DCPs. Whereas others believe that there did need to be some greater clarity around some tasks, and the disposal of sharps was one example, which wasn't always clear to dentists we spoke to. When it came to discussing concerns, queries or changes to scope, the majority of dental professionals would turn to other people like them, so either colleagues or peers through personal networks or online discussion groups. Some people also mentioned employers as a source of information, so principals or practice managers giving out information at staff meetings. And typically, when that was a source, people were positive about that relationship and trusting of the advice provided. CPD was mentioned quite frequently as a good way to keep up to date on scope changes. And for some, would also go to GDC, either through the look at the scope of practice document, go on the website, phone up, or similarly with professional bodies, if there was a concern, there'd be for some a first port of call. This was an area where we put a question on the dental professional survey, which is a big online survey, and we asked how much, if anything, would you say you know about the scope of practice guidance? And it was reasonable levels of knowledge, I would say, were reflected. So 3 in 5 dental professionals said they knew a great deal or fair amount about the guidance document, with most typically it being a fair amount, just under half of dental professionals feeling that. We can break that down a little bit more by job role. And you can see here that the first 3, dental therapists, orthodontic therapists and dental hygienists, were much more likely to say that they knew a great deal about the documents. Over 4 in 5 in each of those categories knew a great deal or a fair amount. Towards the bottom of the list, you've got dental nurses and dental technicians who are perhaps not quite as familiar with the document itself. The discussion groups gave a little bit more context as to why that might be. Dental technicians, 13% actually said they'd never heard of it, which is quite a big difference to some of the other roles. But they typically felt that scope had been really well drilled into them through their education, which is possibly an explanation as to why they hadn't been so familiar with the document post-education. If we turn now to look at how often dental professionals had used the scope of practice, very few reported never looking at the scope of practice document. That was only 5%, so just 1 in 20. At the other end of the spectrum, looking at that top bar, which shows sort of overall dental professionals, you have 16% who are referring to the guidance at least once a month, so weekly or more or monthly. You've then got most people in the middle, so 22% or every 2 or 3 months. The biggest category is that 32%, which is once or twice a year. That was most typical. And then 17% rarely, so not never, but not very often either. And it's quite a flat picture by role if you look at it by all the different roles. There's not a lot of variance in terms of how often people are using it. And in terms of the order of roles there, it really mirrors the awareness of the document that we've talked through before. Stakeholders were more likely to be regularly using the document, and they were using it in a variety of ways. So educators have been using the document to help them design new training courses or update the content of current courses, and also used when discussing development opportunities with professionals. Employers and managers also use it for developmental reasons with staff, so to see how staff could progress and opportunities for further training, things like that. Professional bodies and the GDC are using it to provide advice and guidance to dental professionals. So when people are seeking clarification on whether tasks are within their scope, and they will commonly phone up a professional body or GDC, the first thing that gets referred to is that scope of practice guidance. And it's also used in fitness to practice processes. So the GDC uses it in initial assessment process, during hearings and by expert witnesses, and indemnifiers also use it in a similar way. So when they're building a legal or regulatory case to support a member, it's used to provide clarity on whether they acted out of scope and used in hearings. So turning to the impacts of the document and the perceptions of it. The first question we asked was, does scope of practice have an impact in terms of preventing out of scope working? That's clearly one of the key aims, to prevent out of scope working. And the first thing to say here is that DCPs are obviously wary of working beyond scope and keen to avoid it. However, some people did admit having undertaken out of scope tasks on request of a dentist. It felt there was a role of hierarchy playing in here, so some DCPs feel that all the control lies with the dentist and they have little influence over the tasks they undertake. And that can sometimes lead to an out of scope task being done. There's differences in how easy different roles find to push back against requests that they perceive to be out of scope. So hygienists, dental therapists and clinical dental technicians typically felt more comfortable saying that a task was out of scope. And also those in a hospital setting, including dental nurses, also felt more comfortable saying something was out of scope. And it's worth saying, in hospital settings, people did normally find the roles a little bit more clearly defined, which is possibly playing into that. Dental nurses in a general practice setting were more likely to struggle to challenge out of scope requests. And again, this probably feeds into the sort of role of hierarchy that I just referred to. A common task reported was pressing the buttons on an X-ray machine, which they generally felt to be out of scope, but were frequently asked to do. And in terms of the role of the guidance in minimising out of scope working, there were a few instances reported of DCPs using that document to support their position, to say, look, it's not in the document, or it's in the document that I can't do it, so it's out of scope. So in that way, it may be playing a role in ensuring DCPs don't work out of scope and ensuring public protection. So as well as out of scope working, the research investigated whether an unintended consequence of the document could be that overly cautious use might hinder skills mix and developments. With a few dentists reporting that some DCPs are using the guidance document to prove a task's out of scope if it's not specifically listed on there. And in these cases, dentists felt DCPs were being overly cautious. So just to be really clear on what the issue is, it's that not all tasks are listed in the document. And some DCPs will not feel comfortable doing unlisted tasks and push back on requests to do so. And that could be one of two things. It could be appropriately cautious and to push back where it's not obvious that the task is in scope. And that's when we'd say it ensures public protection, the document being there. Another view of it is that quite often those pushbacks are overly cautious, in which case it could be said to impede flexible use of skills within the team. And the problem here is that it's really a judgment call, and that individual judgment can and frequently does differ between different members of the dental team, with sometimes the dentist taking one view and the DCP in question taking another view. For some, the solution is just to make the document more comprehensive. So by adding detail and regularly updating the guidance document, you remove the issue essentially that not all tasks are listed, which makes it less of a judgment call, less subjective and open to interpretation. So yeah, moving on, lots of factors have an impact on DCP abilities to work to their full scope, including both referrals and skills. So starting off with referrals. Hygienists, dental therapists, orthodontic therapists and clinical dental technicians often felt that dentists weren't referring enough to them, and there could be several reasons for this. Lack of dentist awareness of DCP skills could be one. Another one that was reported was that sometimes there are very complex cases involved. So a therapist might be able to start a bit of work, for example, but not complete the full treatment. For example, if decay in the tooth is near the nerve, so a dentist might not refer it in the first place, fearing that that would be the case. There are also issues to do with the remuneration system and financial incentives within dentistry. So there was a feeling reported the system doesn't incentivise private dentists to refer to DCPs, and it also doesn't incentivise DCPs in NHS settings to always take on referrals. With DCPs in England having a key concern that they've got an inability to generate a unit of dental activity, so they can't control or receive payments directly. The key issue in terms of this piece of research here is, can the scope of practice guidance document help these things and make referrals more likely to happen? So it clearly can play a role in raising dentist awareness of DCP skills, so it can help in that case, but it can't help in terms of changing the nature of cases that a dentist or DCP will see. It can't change the remuneration system. So the conclusion here is that it's unrealistic to expect the scope of practice to play a transformative role in enabling DCPs to work to their full scope, but nevertheless it could help in some cases in terms of that awareness raising piece. Turning now towards skills development. Some employers and managers did say they used scope of practice to see how staff could progress and opportunities for further training, as I mentioned earlier. But educators felt that many dentists weren't maximising the potential of staff. While there's a gradual shift to more diverse teams being seen, there's still a feeling that many dentists wish to retain control. The quote there, for example, saying dentists are often surprised at the capacity of dental nurses. This was reiterated by dental nurses themselves, who didn't feel there were many progression opportunities, in part due to dentists not understanding their full capabilities or how they might be able to expand their scope. And there was also an issue around not having opportunities to try out skills learnt. Again, focusing on the document itself, DCPs are not generally using the additional skills section of the guidance document, and we're often keen to have more detail on how additional skills could be achieved. So the what counts question, what type of training, how many hours would I have to put in for something then to be in my scope? And having a little bit more detail around that could help to encourage DCPs to expand their scope. Again, this is another area where the scope of practice plays a part only. There are contextual factors as well around skills development. So dental nurses noted there was often no financial reward for using new skills. And again, the scope of practice isn't going to necessarily solve that, but it can solve some things around awareness and contribute to more skills being used by different people. In terms of perceptions of the guidance document in general, it was felt to be clear overall, outlining the different roles within the dental team. The format was well liked, the bullet points were seen to make it easy to digest. In terms of what could be improved, the main issue was that it was seen by most as a list of tasks that a dental professional should be able to do or cannot do. It sort of states in the introduction that it's not an exhaustive list of tasks, and it shouldn't be seen as a list where it's saying you can do this or you cannot do this. But it was a very broad perception that that's exactly what it is. And if there is a list, there was a general feeling that it should be comprehensive. So the current guidance is seen by many as too vague in places and subject to interpretation. A specific example was under the direction of another dental professional was felt to be unclear. So does the dentist need to be in the same room as something happening, or can they just explain what needs to be done? Was two examples of how that could be interpreted. There's also more detail needed in some areas. Again, a few examples: what kind of impressions are dental nurses allowed to take? Are orthodontic therapists allowed to undertake tooth whitening? And again, are just about additional skills needing clarity in terms of how they can be achieved. And so before concluding, something quite different, which was the public perceptions of the scope of practice guidance documents. So when the document was being created, it was originally felt it could help patients understand the roles within the dental team. But from those we spoke to, it was clear that the public aren't aware of this document, and they don't feel that they need to either. So they're generally aware of dentists, of dental nurses and hygienists, and although they might not know the full scope of each of those roles, they've got a pretty good idea of what they do, but they were rarely aware of other members of the dental team at all. We had a lot of interesting discussions over what they thought a therapist might do, what they thought a technician would do, but there was very limited understanding at all. However, it wasn't felt to be a problem. They felt they just didn't need to know. They've tended to feel they're going to go to the dentist, good first port of call, and the dentist can refer them to others as appropriate. So they've got a couple of quotes on that there. So, you know, the dentist is the person who assesses your mouth, they'll outsource you depending on what you need. Or people that said maybe it's not the dentist, but maybe the receptionist has a kind of triage. You just ring up, say what you need, and you'll be sent elsewhere. You don't need to know yourself. There's a feeling that a dentist is like a GP, so highly trusted, can do everything, highly qualified. Why would I go somewhere else if I could just go to the dentist? So reflecting that, there was little interest from the public in direct access, unless it would save them money. However, some people were happy just to go direct to a hygienist because they felt they knew quite clearly what that role was. We did show the public the scope of practice document within the discussion groups and asked them for their comments on it. And it was generally not felt to be public facing. It wasn't seen as accessible for them. The assumption was that it was a document designed with dental professionals and stakeholders in mind with the way that they might use it. So you see people there saying, you know, it's a technical document, it's not really helping me decide what I need, or, you know, I just Google it, it's too detailed for me. So to be used, it would need to be shortened, and for some people it would need to be interactive. So some people talked about how they would mainly go for information that was in an app, in a video, in a web format with clickable links that could be expanded if they're more interested, or not if they're less interested. Some people would prefer hard copy, so a simple poster that could be displayed in the dental surgery with each member of the dental team and a short summary of the role. However, it is worth reiterating that there was no real appetite for more information in any form, so I think a reason would need to be identified to develop something different specifically for the public. So yeah, to conclude, one strong headline was that there's strong support for the scope of practice to continue to exist. There was significant fear of out of scope working if it was removed. And while dental professionals don't tend to refer to it regularly, it is on hand when needed, with stakeholders finding it a really essential reference point when designing courses, when advising dental professionals, and in FTP cases. There's a consensus that it's not public facing, nor does it need to be. There was a lot of agreement over the need for it to be more comprehensive and more regularly updated. It was seen to be needing to be updated to reflect technological and industry changes, as well as to clarify some of those grey areas we've mentioned and to provide more information on how to obtain additional skills. It was felt that changes could be communicated or reinforced as part of CPD, and communicating changes would also be a good opportunity to raise awareness and use of the document. The document should be owned by the GDC, with professional bodies and educators consulted on changes, as well as participating in wider conversations on scope and skills mix. So I brought out a couple of times as going through some issues around scope can be partially solved by the document, but there's a lot of other issues that need other interventions and other discussions which are sort of outside the remit of the document itself. So that was the headlines briefly. The full report is published on the GDC website for people that would like more detail, and I think we're going to have some Q&As before I'll hand over to Katherine at the GDC to talk through some more evidence.
So Helen, have we had any questions submitted?
We haven't really had any submitted. We just had one that I've just responded to within the feed, but we haven't had any others.
Okay, fantastic. In that case, we will crack straight on with Katherine's presentation. Katherine, did you want to take us away?
Yes, thanks Lisa, thanks Jane. So we've looked at how the scope of practice is being used by dental professionals, but we also wanted to kind of get a sense about how it's being used by the GDC. So how does it impact our own processes, and in particular our fitness to practice process? I'm just going to take you through a few of the high level figures of scope of practice cases in FTP. So looking at this slide here, we can see that over a 5-year period between 2015 and 2019, there were 9,513 cases, fitness practice cases raised with the GDC. Now, I should point out at the very start that that's all of the cases that come to our doorstep. There will be an awful lot of those cases that will close at the very start of the fitness to practice process. So of those, 1,296, so that's 14%, were concerns raised about DCPs. And of them, 305, so 24% of concerns about DCPs were concerns about scope of practice. So if we break that down by DCP title, it's quite interesting actually. So this table here shows the DCP titles, the number of scope of practice and percentage of scope of practice cases raised, and compares that to the percentage on the DCP register. So let's look at technicians. So dental technicians account for 8% of the DCP register, but they also account for 36% of scope of practice cases raised with the GDC during that time period, that 5-year time period. Now we compare that to dental nurses. Dental nurses account for just over 2/3 of the DCP register, but only 1/3 of scope of practice cases. So you can see that dental nurses are underrepresented in that sense. I should just point out that there are some DCPs who have multiple titles against their name, so this includes all of the titles that we hold on our register. So if we move on to the next slide, we can look at the scope of practice cases that are at the hearing stage of FTP. So the hearing stage is the most serious stage of FTP. It's the very end, and it's where the most serious cases are. So DCPs involved in cases that end up at scope of practice cases that end up at a hearing are made up exclusively of dental technicians, dental nurses, and CDTs, with dental technicians having the highest number of scope of practice cases at this stage. So other DCP groups usually have scope of practice cases closed earlier on in the fitness to practice process, usually at the case examiner stage. And it gives us some indication of the seriousness of breaches that are reported for each of the different DCP groups. The next slide then looks at the outcome, the most frequent outcome when they get to this hearing stage. So the question is, are the sanctions that are posed by a GDC hearing for scope of practice cases, are there sanctions imposed and are they serious? And well, what this chart shows us is yes. You can see here that the most common outcome at a hearing for scope of practice cases are suspension, erasure and reprimand. So they're much less likely to have a finding of fitness to practice not impaired. So that tells us that when cases do come to a hearing, scope of practice cases do come to a hearing, there's often found to be patient safety concerns that are serious enough to require a sanction. Okay, so we've heard today about how dental professionals and stakeholders are using the scope of practice and how the GDC is using the scope of practice. So that brings me nicely on to, well, what's next and how are we going to build on this work? So as Guy really nicely outlined at the beginning of this presentation, we need to do a review, and we've committed to doing a review of the scope of practice for a number of reasons. So the next stage is to think about, well, why do we need to have a scope of practice? Let's take this right down to the very beginning. What's the purpose of the scope of practice and how does it protect patients? And in thinking about this, it's interesting to note that the GDC is the only professional regulator that holds a scope of practice document. Other healthcare regulators don't need to have one. It doesn't exist in other spheres of healthcare. So why is that, and why do we need to have it? And in coming to the, thinking about the purpose of the scope of practice, we'll draw really heavily on the really good work we've seen so far, the good findings of this research, and some, we'll talk quite closely with council about it. And once we've got a real understanding about the fundamental reasons why we need a scope of practice, that'll lead us on to, well, what format does the document need to take? You know, what's the best format for the document to enable us to meet the purpose of the scope of practice? And as Guy said at the beginning, you know, the GDC is moving in a different direction now. We want to really allow dental professionals to use their professional judgment to do the right thing because it's the right thing, not just because they're told to do it. So how can we draft the scope of practice in a way that allows dental professionals to use their professional judgment? I hope to be in this position by March. And then once we've got a sort of understanding about the purpose of the scope of practice and the most appropriate format, the next thing will be to populate that document. So we will need to draft what needs to sit underneath the different titles. And in doing this, we will need to engage very, very heavily externally. And this will involve engaging with you as dental professionals, with GDC stakeholder groups such as education providers, professional associations and indemnity providers, making sure everyone's heard and that we end up with a document that's really fit for purpose and ends up protecting patients. This will not be the last you've heard from us on this subject, so please be assured that is the case. We will be wanting to, you know, hear from you and talk to you again about this, so just wait for that. And all that remains me to say now is thanks for your time this afternoon and to hand back to Lisa.
Thanks, Katherine. We do have a little bit of time now for any further questions. Helen, do we have any through the Q&A system?
We do have a couple of questions. Someone asking about if this came up in the research, if it was mentioned by dental therapists about new elements of scope which are not listed in the scope of practice, if that had come up in terms of any additional queries coming through from members in terms of new things which are in scope as sort of dentistry is changing.
Okay, so something around new techniques, treatments being developed in dentistry and how they would be included in scope. Is that correct? Jane, did you want to take that one, or Katherine?
Yeah, I mean, in the research there was, through all groups, people were talking about how rapidly the dental industry evolves and talking about a lot of different new technologies, new techniques, and the fact that there is a lag in terms of getting them into the guidance and the document, and that causing an issue. I can't think of the specific examples the dental therapists would have referenced, but I know that was a common theme in general.
Okay.
Groups.
Guy or Katherine, did you have any comment?
Well, I think from my point of view, this really does play into like what's the best format of the document and how do we make sure it's agile and we can keep it up to date. What we want to do is help effective team working so that everyone in the dental team is working to their full skills, and we don't want to stifle any innovation. So perhaps having a very detailed list of tasks isn't the best way of achieving that purpose. So that's something that we'll be bearing in mind when we're kind of working out what's the best format of that document and where it sits and how best to communicate it. But we are really, really aware of the fact that, you know, times are changing and technology is changing. I mean, even in the last 6 months, there's been a huge change in the way that healthcare in general is provided, and the scope of practice really does need to be able to keep up to date with that.
Yeah, brilliant. Helen, any other questions have been posed for our speakers?
There's a couple of others, but I think they're more comments than questions. Okay.
There's one here about, has there been any study on COVID-19 and its influence, but this is on gum disease or gum, but I think this is a little bit clinical for this discussion. Guy, do we want to say anything more broadly about the research that we're doing around COVID-19 with patients and professionals?
Yes, we are conducting 2 pieces of research, which are actually, one of them is out in the field at the moment, which is a survey where we're going to ask dental professionals about the impact of COVID-19 and to ask them to kind of draw on their insights and perspectives on how things have differed as a result of COVID-19 now compared with the situation pre-COVID, and also what the implications might be of those changes. And we also have, as you mentioned, a parallel piece of work where we've talked to patients about their experience of accessing dentistry during the period of lockdown, and again, asking them to think about what changes that might lead to in the way that they approach dentistry in the future. So yeah, both those pieces of work are underway, and we would be expecting to publish those later this year.
Excellent. Thank you, Guy. It just remains for me to say then, I think, is there any final comments any of our speakers would like to make before we draw the session to a close? I'm seeing some shaking of heads. Oh, sorry, Helen?
I was just going to say, it just looks like there's a couple of questions that have just popped up.
Okay, would you mind just reading them out for us?
Yeah, so there's one from Vicky that says, who in general is reporting a potential breach in scope? Is it dentists, general public or peers?
Katherine, did you have a look at that through any of the scope of practice analysis?
From sitting in various meetings about fitness to practice, scope of practice allegations come from a range of different informants. Quite often it's colleagues or peers or other dental professionals, but sometimes they come to light as part of a complaint made about something else. So if for example, a patient is making a referral to us about the clinical care they received, it might transpire that part of that treatment was provided out of scope, and therefore it becomes also a scope of practice issue as well. You quite rarely see patients referring things knowing that they're out of scope. It kind of transpires as part of a wider complaint or from other professionals.
Brilliant, thank you. And Helen, the second question?
There's one more that's just, how do the GDC foresee educational institutions adapting to any changes that are made to the scope?
Well, did you want to take those?
Yeah, so I mean, I think, and I've seen from a couple of questions here that, you know, if we change any changes to the format of the scope of practice will affect a wide range of different stakeholders, internal stakeholders and external stakeholders, and we will be engaging with all of those groups on any changes. It might be that we don't have one scope of practice document. We may have different documents or different scope of practices that reflect the needs of different groups. So, you know, there may be one for patients that gives a very basic overview of what the different members of the dental team do. It may be that there's one for education providers that really sits very well with the learning outcomes that we also produce. So, you know, there are different ways of doing it to make sure that it's conveying the right things to the right groups, but we will make sure that we engage with all of those groups when we're reviewing it.
Yeah, great. So the format just needs to reflect the purpose of each of the scopes. Brilliant. Helen, was there anything further?
I think there's just a few other more sort of comments. I mean, there is one that might be something you want to get back to at a later date, but it's whether the webinar is registered as something that could be used for CPD or not.
Yeah, I can certainly get back to participants about the CPD question. It's certainly non-verifiable CPD, but we won't be able to provide certificates, unfortunately. Great. In that case, it just remains for me to say thank you for everyone who participated in this live event. Thank you to our speakers, particularly to IFF Research, our independent researchers, for coming along today and sharing the findings from the research. And to Guy and Katherine, thanks for your time. Like I say, and as it is on the slide right now, we'll post this recording of this event on our YouTube channel and put links to our website as well. That should be available tomorrow or Monday at the latest. So thank you everyone for your time, and we'll see you again soon. Thank you. Bye.